Good afternoon. Welcome to the daily briefing here at St. Clair County EMA, where we're joined with Chairman Kern and Sam Bierman on this Memorial Day weekend. And Sam, we have some numbers, and they're going the wrong way today.
They are. They're not cooperating with the direction we would like them to go. But we're going to have those days,
Yes.
And so we're just going to take it one day at a time. So as of today, we have tested 6,105 St. Clair County residents with 1,070 positive test results, which is an increase of 63 from yesterday, and that includes both males and females from their teens up to their 100s. We are at 4,950 negative test results with 74 results still pending. And we do have some more sad news to announce today, as we did yesterday. We are adding 3 additional deaths, which brings our total to 82. The first was a female in her 80s who did have underlying health conditions. And the second were 2 males, both in their 80s, who both did have underlying health conditions. And as always, our thoughts and prayers go out to those families. For those that have completed the required IDPH 14-day quarantine, we are at 682. And for state totals, 747,921 tests have been performed, with 110,304 positive test results, which is an increase of 2,508 from yesterday. And we are at 4,856 deaths for the state, which is an increase of 67 from yesterday. For hospitalization numbers, and these are for hospitals that are in St. Clair County, we currently have 52 patients that are admitted due to COVID-related reasons, and 5 of those are on ventilators. For congregate living facilities that are in outbreak status, and that is 2 or more staff or residents that are either COVID positive or who have COVID-like symptoms, Brea of Belleville has 24 cases and 2 deaths. Brea of Cahokia has 8 cases and no deaths. Caritas Family Solutions in Belleville has 11 cases and no deaths. Cedarhurst of Shiloh has 11 cases and no deaths. Colonnade Senior Living in O'Fallon has 4 cases and no deaths. Four Fountains in Belleville currently has 104 cases and 20 deaths. Help at Home in Belleville has 2 cases and no deaths. Help at Home in O'Fallon has 5 cases and no deaths. Knollwood Retirement Center in Caseyville currently has 7 cases and 1 death. Lebanon Care Center in Lebanon has 52 cases and 10 deaths. Memorial Care Center in Belleville has 43 cases and 5 deaths. New Athens Home for the Aged has 34 cases and 1 death. St. Paul's in Belleville has 37 cases and 9 deaths. Swansea Rehab and Care Center has 6 cases and no deaths. And finally, TDL Incorporated in Belleville has 4 cases and no deaths. And I will turn it over to Chairman Kern for his update.
Thank you, Sam. So we'll move into the zip code reports. Remember, if you don't hear your zip code, it doesn't mean that you don't have any COVID positive diagnosed individuals in your zip code. What it means is that number hasn't risen above 5 yet. So in 62059, we have 7, and that number remains the same. In 62201, 15 remains the same. 62203, the number also remains the same at 35. In 62204, we have an increase of 1 today to 42. In 62205, we also have an increase of 1 to 44. In 62206, we have an increase of 3 to 92. In 62207, we have an increase of 1 to 64. In 62208, we have an increase of 1 to 59. In 62220, we have an increase of 4 today to 119. In 62221, we have an increase of 3 to 94. In 62223, we have an increase of 1 to 46. In 62226, today we see an increase of 7, and that takes our number in 62226 to 123. In 62232, we have an increase of 1 to 18. 62239 remains the same at 11. 62243 remains the same at 7. 62254 remains the same at 27. 62257 remains the same at 7. 62258 remains the same at 14. 62264 is static at 18. 62269 is also the same at 17. And 62285 remains the same at 8.
62269, 67.
62269 remains the same at 67.
Thank you.
Thank you, Herb.
The numbers get to running together, I know. That's what we don't want. And today is Sunday question and answer day. We appreciate everybody who submitted their questions through the county portal. And we'll be joined with Brian Whitaker and Randy Randall also to answer your questions. So, Ryan, did we get some ones that are easy, I hope?
We have some, and we have some that we'll probably have to do some research to get further answers. But we'll start with Sam, as most questions come in are health department related, but want to make sure we try and get as many of these answered as possible. The first one is questions about the rapid testing. What can you discuss the accuracy of the rapid tests and what that does to the accuracy of the numbers?
So the only facility that is using that specific test is the Walgreens in Cahokia. And not only them, but all of our testing sites, we as a health department are in touch with them very frequently about anything that they are requesting from us, any needs that they might have that we might be able to help them with. And the Walgreens in Cahokia is performing the test per CDC guidelines. And, you know, that's all we can go off of right now is that they are following the guidelines that CDC has put out for this specific test.
Second one's not really a question, just somebody wanted to express their appreciation. They said, please let Sam know we appreciate the hard job she has and that better days are ahead if we follow the advice and use caution when we have to go out. So,
Well, thank you for that. I appreciate it.
next question leads into our congregate care facilities. If a congregate care facility resident is confirmed positive and has to be transferred to a hospital, are they included in our hospitalization numbers, and do they remain included in the long-term care number?
So yes, that is correct. When someone that is already diagnosed as COVID positive would leave a long-term care and for whatever reason need to be admitted to the hospital, they would be included in hospitalization numbers for that day, as well as they would stay in the congregate, in the outbreak setting numbers. They would stay there as well.
Okay. While we're talking about congregate care, one other question that's come up here says, I work in a nursing home. Can you tell me why we haven't tested all of our residents and staff, as we have residents that appear to be symptomatic?
So what I can tell you is, as a local health department, as well as Illinois Department of Public Health, we are already underway in that process. We have already tested a few of our long-term care facilities, and we are going to be continuing to go down that list and make sure that every long-term care and congregate living facility in St. Clair County does get tested. But to whoever asked that question, if you feel that your facility is in need of being tested sooner, please feel free to reach out to me directly. I will give you my work extension number, which is 825-4466. Please feel free to reach out anonymously if you would like, but we're always here to help answer questions, and we are underway with testing all of our long-term cares, and that includes the staff as well as the residents.
And Sam, the long-term health care facilities have the responsibility of reporting those to the health department also.
That is correct. Any testing that is done in long-term care facilities for COVID, the following three things need to be reported to us. Any tests that are done, positive or negative test results, as well as any deaths that occur from a patient that was COVID positive. So yes.
Very good.
Okay. Chairman Kern, the next question came in was for you, and the question is, when will additional guidance be available for summer camps and gymnasiums? And does it differ from CDC recommendations?
So the guidelines were just issued today from the Illinois Department of Public Health and also the Illinois Department of Commerce and Economic Opportunity. That guidance is available on their websites, and so you need to look at that. We've also posted that on our EMA website as well as our Facebook page, and anywhere we can post those guidelines. You need to take a look at those and see what they say. We would assume that they are in concert with the CDC guidelines.
Hey, Randy, I think we've got the number that we can put up also to where they can call if they need to get clarification on it, because we have had some people say, well, I don't understand this, and they're better off to call them and let them explain to them.
Absolutely. Okay. Chairman Kern, another one that came in was, can you discuss the future plans that you had mentioned about helping businesses within the county as they start to open back up, and when can they start applying for that assistance?
So we've been planning for offering grants for people, businesses that want to start to open. The only thing we don't have is the final approval from HUD to be able to use our monies for that. We expect that approval to come. We're so positive about that we will be accepting applications on our website for this program by the end of the week. You'll be able to access that on the St. Clair County website for the St. Clair County Grants Department. Go on there, and we'll be talking about that this week as this gets fleshed out. But you can expect that you'll be able to start to apply by the end of the week. And then our goal is to get those dollars out as soon as we can. But that really all depends on the HUD approval. If there are more applicants than we have dollars, then we'll be doing a lottery system where hopefully we'll have a business come in or somebody or in a public area draw names out, and we'll see how far the money goes. But we hope to help a good number of businesses in the county with restart money.
Well, I think, Chairman, as this moves on over the next week, we'll be having Mr. Stubblefield come back in, and you and him can kind of lay out the...
Right.
Yeah.
Okay. Chairman, one more for you while we're here. It says, why is our state and county continuing to follow the assumptions of modeling when states like Georgia and Florida have 4 weeks of real-time data that show no negative impact of being much more open than Illinois?
So we're following the state of Illinois plan. It's the law. It's what we're required to do. It protects our businesses. It's going to allow opening on the 29th into phase 3 of all the businesses. I'm sure that the health officials in the state of Illinois are monitoring those numbers that you see from those other states and taking that into account when they're reopening, and the guidelines they issued today, multiple pages of guidelines for businesses to follow when they reopen. So hopefully we won't have an outbreak that will occur because of the reopening of the economy. But we're excited about it. We're looking forward to getting back to our favorite places and getting back to life kind of normal, and hopefully by sometime soon in a totally normal fashion.
Thank you. Director Simmons, kind of going off what the chairman had just said there, what effect do you think this weekend could have on the numbers that we're monitoring?
Well, as we said yesterday, with the holiday weekend, we're definitely going to be watching the numbers. We saw a little spike today, as Sam reported. If people use social distancing and use some good common sense, you got to look at this, the region, just not here in the county, and that's why they were made up that way. So we're not just looking here, we're looking all around the region that we're in. So I just hope that the people will use some good common sense, and then we stay below the metrics that we need to be. But we're going to be watching it.
And when you talk about those metrics, something that was asked early on here today that's kind of important was, do we see our positives increasing proportionately with the number of those tested? And I think the answer to that is yes. We're staying at the metrics that we need to continue to meet for phase 3, that while we're seeing more testing, we do expect more positives, but the important thing we're looking at is that comparison of positives to new tests performed.
But when you say we are lumped together with 2 districts in southern Illinois with the hospital districts 4 and 5. So if you look at our specific numbers today, we rose above the metric that's required. We did approximately 200 tests, and we had enough positives that we were about 30%. The metric says below 20. So we didn't do as well as our counterparts, but we think that because we're lumped into districts 4 and 5 in the southern part of Illinois, we still are able to meet that metric that is being supplied by the state.
Very good. Director Simmons, another question that came in says, how can you guys continue to take the criticism from the few day after day? I follow these updates every day, haven't missed one, and I'm thankful for what everyone is doing. I followed the EMA page for years, and I'm a proud supporter of Team St. Clair.
Well, we appreciate them following the EMA page, and as far as the criticism, it's nothing personal, and we've made that very clear. We're here to do our job, and we know people's been hunkered down, and stress has been up on everybody. It's been up on us, so don't take anything personal, boss. But no, it's nothing personal. And when we've said this every day, we're all going to get through this. Yes, some of it look at a different way than others do. We're looking at it from the side of what's best for public safety for our citizens of the county.
Very good. And one more for you while we're here.
He's picking on me today.
Is there any word on when daycares and preschools will be allowed to reopen, if they're included in this May 29th opening?
The state task force last week kind of indicated they were going to be loosening up on the daycares, but they have not posted that yet. But I'm sure once we get notification of that, we will post that. But stay tuned for that. It wasn't in there today in that release.
Okay. Sam, we'll come back to you for a few here. Next one for you, I should say. I would like to know how many of the positive cases in children are contracted by an unknown source. Example, are kids getting it from play dates with other asymptomatic kids, or are we seeing more kids getting it in places that have other positive family members?
So that is a very good question, because as we have talked about before, when we have younger kids get it, we've said that it's not their decision to leave the house to go out to, a family gathering or to the store. But for those under 10 that we have seen with COVID positive test results, the majority of the time there is someone else in the household who does have a COVID positive test result as well.
Okay. Another question, kind of going back to something we talked about a little bit last week. It says, please explain how antibody tests are included in the counts. Last week, Sam indicated they were included. Do you include both negative and positive results? And are you including results from all antibody tests? Only those specific to COVID? Only those approved for FDA? And final part of that is how many positives this week were from antibody tests?
That's several questions in one. So let's start with, yes, we do include antibody positive and negative tests in our numbers. Let's see, what was another part of that?
Do you include them? Are you including all types of antibody tests that are reported to you, and how many last week?
So talking about the, let's see, which one was it? Approved by the FDA. So as we have said before, that this is not completely approved by the FDA. It's been given an emergency authorization use. So regardless of that emergency authorization use, we do count those in. And for which ones do we count? It is for COVID, a COVID serum test only for those that we would count.
And have we had any of those reported in this week's numbers?
This week's numbers, no, we have not. But again, keep in mind, we can only report to you guys what has been reported to us. So that is why we continually reach out to any facility that is doing COVID testing. If we are not receiving results from them and we think we should be, we're reaching out to them and saying, hey, don't forget about us. Positive and negative test results should always be reported to St. Clair County Health Department, no matter what type of test you're doing, whether it be the one that goes up your nose, the serum testing, or at Southern Illinois Healthcare Foundation, they're doing the throat swab. So all of those results should be coming to the health department.
Okay. One more for you while we're here. It says, can you separate out the number of positives in nursing homes and congregate facilities from the total positives, or is there any reason why we're not doing that already?
So with these, when we talk about congregate living facilities and positive test results, because congregate living facilities, those numbers include not only positive and negative test results, but perhaps someone that could be symptomatic. So it's kind of hard to break up those numbers when we have several factors that go into how we delineate those numbers.
But reporting our positives, those are only lab-confirmed
Correct.
Positive tests.
Yes.
So that's why we don't want to do anything that would jeopardize the integrity of that number.
That is correct. So if someone is symptomatic, we take that as asymptomatic, but for those that are a true positive that have had the test and we have a lab result, that's what gets counted toward the positives.
Very good, thank you. Chairman Kern, a few more that came in here for you. One of them is, has Belleville made any decisions yet on fall celebrations or holiday celebrations that you're aware of?
So we haven't been made aware of anything but the summer events that have been canceled, like Art on the Square that was canceled. The Shrine Parade is canceled. Any events that are right around this time, that, we know about those. As far as anything in the fall and winter, we haven't been made aware of anything yet, but we would assume that they will be done in concert with the rest of the state and the executive order.
Another one says, I heard the governor announced yesterday that mortgage assistance will be available. Where can that be applied for?
So the legislative session actually ended last night about 2 o'clock in the morning. I know that there's a bill that had about $500 million for mortgage and rent assistance that passed. As far as guidance on how to access that, we don't have that yet. We've reached out to our state representative, LaToya Greenwood, for some guidance. So hopefully we'll have that for you this week as soon as the guidance becomes available.
Okay. And one more for you while we're here. Says, do you think there should be modifications in cities such as Belleville, as we've already heard other cities announce they're going to, that could possibly close roadways to allow additional restaurants and bars to open for the outdoor dining exemption that was added for Phase 3?
So if there are things that can be done to help businesses reopen and still be in concert with the law that's in the state, that the requirements that go along with opening restaurants and businesses, we're all for that. We're all for business and commerce reopening. O'Fallon has done that. We sure hope Belleville follows them. Fallon has been a leader in getting their Main Street open, getting their areas open for restaurants and bars, and so we look forward to Belleville doing that also.
Friday is going to come quick for Phase 3.
Yeah, it's Friday is going to come very very quickly. That's for sure.
Well, and Chairman, we sent out this notice the first thing this morning when we got it to all the mayors, so they're all aware of it. So I'm sure they're already putting some of those plans, because they, as we know, been anxiously waiting for this. So
And all those guidelines are online. They're
Yes.
on our page. About 80 pages of them, I think, Brian, last I
Close,
checked.
yeah.
So there's plenty of reading out there to do.
Okay. Director Simmons, a couple more here that came in for you. Says, why do you believe some people think our county is responsible for this virus and for keeping us all locked down?
I haven't heard that they think that we're responsible, because I don't. As we've said, this virus to me doesn't know who's at fault. We're not. The county sure isn't. So I'm not quite sure what they're talking about. We're trying to do what has been done around the globe, is trying to stop it. And as far as being responsible, there's nobody here that I know of.
Okay. Another one that came in says, what are the guidelines going to be released for hair salons when they're allowed to reopen? I think that was something you guys kind of touched on earlier.
Yeah, they're in the guidance that came out.
Today
Yeah.
they're listed under personal care
Yeah,
services.
salons and barber shops, so they're listed on there. So I know they got to do by appointment, no walk-ins, I think, still. But if they go on the web page, they can find on the EMA page. They need to go on there that where they can read it and they'll know for sure.
Okay. One more for you here that says, when we talk about gyms and fitness centers, when will the YMCAs be allowed to reopen?
Gyms and fitness centers are allowed to reopen on one-on-one training sessions, I think is what it said in there. I haven't, 80 pages. We got to go through all of it. But I think the full opening is not included until Phase 4 on the gyms and that. So.
Okay, very good. Sam, a couple more that came in here for you. As we talk about gyms and fitness centers, this one says, if a person works out at a gym and is very healthy, can they still catch COVID-19?
So the answer to that is yes. Sometimes, unfortunately, you can just do everything right. You can be wearing a mask, you can wash your hands, and things just happen. But yes, we can have a perfectly healthy person come down with COVID. That's absolutely possible.
Okay. Another one about our congregate, and I think you touched on this a little earlier, but there was a separate question. Why aren't we going into every nursing home in the county and testing all patients and staff?
So we are in the process of doing that, not only long-term care facilities, but we do have a handful of congregate living facilities that are in St. Clair County as well. And we are in the process of testing all of those staff and residents. And we will work our way through the list until all of them have been completed.
Okay, I got a couple more here for you. While we're talking, we'll go through these. Next one, I'm not sure you can answer this one. As I said, there were some difficult ones on here, but how long is a person asymptomatic?
So there would be a lot of factors that would play into that. Every individual would be different, depending on what your health history is. As we have said, that those that have a more complicated health history would be more prone to COVID-19. And to be honest, without testing every day, that's not something we would be able to determine.
And one more that came in for you. It says, if you're a nurse and you were diagnosed with positive with COVID-19, is it safe for you to return to work on your COVID unit if you had been quarantined for 14 days?
So if you are asking if you had completed your 14-day quarantine, could you go back and return to work on a COVID unit? By IDPH guidelines, yes. But keep in mind, each individual specific facility may have further policy and procedure in place that, they may say, no, we don't want you working on a COVID floor. And each facility has the right to have their own policy and procedure in place to be able to say that.
Okay, very good. Thank you. Chairman Kern, a couple more that came in for you. Next one says, a lot of area food pantries have been shut down or requesting assistance. Is there any plans to be able to assist them further?
So some of the food pantries actually shut down because a lot of their volunteers were, afraid to go out. They were elderly or had health conditions. Those food pantries are still in flux because they've got to make sure they have the appropriate number of people to man the food bank. The county actually is looking at helping some of the area food banks throughout the county in the coming couple weeks with some financial assistance to be able to maybe get them reopened if it was a lack of food or a lack of supplies that they had to offer. So those hopefully the food banks are up and running. The ones that are up and running remain up and running, and we're going to try to get those that aren't kind of back up too.
Okay. Another one that came in kind of about the numbers and the metrics we talk about. It says, if in 2 weeks our numbers would happen to skyrocket, is there a possibility that you could move backwards in a phase?
So the we word is, as I said before, we are in District 4 and 5 in Southern Illinois. So if our numbers skyrocket, what I would assume the first policy will be, and it's the reason why we are all getting tested, so that we know where the hot spots are, so we can lock those down. If there are outbreaks, we would like to try to contain those outbreaks. As far as the state moving us backwards, I assume it's a possibility if the numbers become just awful, but it seems to me that we're trying to move forward. And the reason for perhaps being a little slower than other places is to make sure that we've got the spread as controlled as possible. So then when we do find a hot spot, we're able to then isolate that hot spot and know that it's not throughout the county, not throughout the region, but just is an isolated part of this entire southern part of Illinois.
And kind of as you've talked about, and you've pretty much answered this question already, but it says, we've noticed that there's been days that St. Clair County hasn't decreased consecutively for 14 days. If that's the case, why would we be moving to phase 3? And I believe you've explained that.
And that's because we're part of a much larger region. So, we are regions 4 and 5 of the hospital region. So because our numbers are merged with many other counties, that our number then, or the entire number goes below that 20% level.
Well, and I think that's really been a benefit when you look at the overall picture, because as that whoever the person was that sent that information in, if we were just totally based on our county, then we would have that fluctuating, and we could be at that higher end of that metric, and we don't want that. So,
and remember that we're at a higher metric in this county. Yes. That's why we're on here every day, because we want to be below that 20% level. And today we had an uptick, but hopefully tomorrow, everything we do every day has an effect. As we heard about super spreaders the other day, one person can make a huge difference if they're out doing the wrong thing and infecting large groups of people. So let's just wash your hands, wear masks, do what the guidance says, even with the opening up, and we'll be better off. We'll make sure that we don't move back, that we don't have any issues, because we only want to move forward. We're at a point now where we've been locked down for a long time, and now that we're heading forward, we don't want to take that step backward.
Just a couple quick more that came in here for you. Do you know when the courthouse will reopen, and will there be procedures in place for that?
So we're assuming that phase 3 is going ahead this Friday. We will be reopening the courthouse on Monday, June 1st. There will be, every office will have its own specific way of doing business. Many of the offices now are going to take appointments. Anyone that comes to the courthouse will, for most departments, you'll need an appointment to get in. You'll also have to have a mask. And temperatures will be taken of all the customers coming in the courthouse, and we'll just start to re-enter all this together. We've put up a lot of plexiglass, and we've got all the safety precautions. Some offices, like the courts, you'll need to look at the court's website for guidance as to when cases are starting again. A lot of things are going to be done remotely. We're working with technology to, I know the courts are doing that. Also, zoning will be operating in that way too, we believe. So things will be done differently, but the courthouse will reopen on the 1st of June. But we're asking most people make appointments before you come up, and that's it's going to be interesting. But I think we've got a pretty good plan, and we'll be rolling that plan out this week also. So stay tuned.
Okay. And just one last one that came in. Is it okay to visit family members in another county now?
So the guidance from the state says when you reach phase 3 that then you can have gatherings of 10 or less. Right now, that is not the recommended thing. They're saying let's hold off until this Friday. It's pretty close, and then gatherings of 10 or less are allowed. But remember, wear those masks and do the proper hygiene. The social distancing is important. Because a lot of the family you're getting together with may be elderly, may have small children around, and we want to make sure that we control this thing and move back in slowly so that we don't have a resurgence.
Okay. We're joined by Susan Sarfati, the St. Clair County Regional Superintendent of Schools. We did have a school question come in today, so we're glad you could join us here to answer this. And I know it's a little premature as everything is still developing, but the question is, will schools be able to open for summer school or maybe later in the fall?
Well, first of all, we've already received guidance for summer school. Summer school is to be done remotely as we finished up the year. As for planning for next year, the plan is that we open the doors with children with modifications. As we wrap up this school year, then superintendents and school boards and teachers will be moving into the phase of starting to plan for next year. What will that look like? The state board is to be issuing guidance within a couple of weeks as to how school will open in the fall.
Okay, great. Thank you, Susan.
Thank you very much. Director Simmons, the last couple questions came in, very similar in nature. Talks about businesses where there's a requirement for the employees to wear masks, but maybe they're not seeing the employees wear masks. As we saw with the guidelines that came out today, it still does require face masks for employees and guests anywhere that distancing can't be maintained. What do you recommend if they're at a business and they're not seeing that happen?
Well, the customer has a right to shop there if they want to, and if they feel that the business isn't following the recommendation, then they can go someplace else, or they can voice that concern to the management. But again, it's some common sense. If I don't feel comfortable in going in a place that they're not following those recommendations, I'm going to find someplace else to shop. We don't want them to do that, but we just hope the businesses follow the recommended CDC guidelines. It's better for them, it's better for their employees, and better for the customers.
That's all the questions that were submitted. Well, I'm sure there's a few extras that we'll go through and answer that have dropped in while we've been talking here today, but that's all that we had that were submitted through the portal.
Well, good, and we appreciate everybody staying with us today, and hope we answered the questions for those of you who asked them. We want to wish everybody a safe Memorial Day tomorrow. We will be back here at 3:30 for the daily briefing. Just remember, as the chairman said, let's be sensible. Let's be smart about this. If you have to go out, wear your mask, social distancing, and we'll be back here tomorrow afternoon at 3:30. We'll be back momentarily with Cindy and Daisy to translate this into our Spanish communities. Thank you.